Psychotherapy and emotional support are two very different things. But the public, and I'm sorry to say even some therapists, don't seem to know the difference. For example, general-purpose AI chatbots like ChatGPT, Claude, and Gemini are commonly used for AI therapy. They're available 24/7, they're free or very low cost. They'll listen without complaint for as long as you like, they never argue or complain, and they can give you some practical tips about how to work in your relationship or how to think more positively. Many people praise the quote-unquote therapy delivered by AI chatbot. But here's the thing. These chatbots deliver no such thing. They provide emotional support, not psychotherapy. There's a basic confusion about what psychotherapy is and how it differs from emotional support. And so in this video, I'll talk about that difference and how psychotherapy got confused with emotional support. I'm Dr. Stephen Reidbord. I'm a longtime psychiatrist and psychiatric educator, and this is More Than Meds. Emotional support is, or should be, widely available in everyday life. After all, we're social animals. We can get emotional support from friends, from families, from romantic partners, religious and spiritual communities, social clubs, political allies, co-workers, bartenders, hairdressers, basically from society at large. Also, our natural environment, our pets, our parks, our beaches, our gardens provide us with emotional support. And we, human beings, provide each other with emotional support by producing art and literature and music, things that lift our soul. But for decades, observers have sounded the alarm that we're losing emotional support community in our society. Families are fragmented, organized religions in a long decline. As bowling leagues and bridge clubs die off, more and more of us live isolated lives in nuclear families or by ourselves, entertained by the internet or television. We're physically disconnected. Our social lives are delivered through screens, if we have any at all. There just isn't as much emotional support anymore. AI partly fills this need. In part, that's why it's so popular. Chatbots are interactive in real time, kind of like a person. They mimic human conversation. They bank on our innate creativity and our ability to anthropomorphize, that is, treat non-human things as human, just as we do with our pets and our cars and with Siri and Alexa. We pretend we're talking to another person. It's sort of fun. We get to exercise our imagination a little bit. But AI designers go much further. They tune these chatbots to be agreeable and pleasant, even sycophantic. That is, like a yes man, that was a great idea, you're so smart, I totally agree with you, how creative of you. Some chatbots speak their responses using a human sounding voice. All of this is designed to be engaging and to encourage emotional attachment. This isn't by mistake, it was a design decision. They created AI chatbots to be this way. I did a video on how companies hack our appetite centers with junk food and our attention centers with social media. And now they're hacking our emotional attachment centers with AI chatbots. There's the video right there. All for commercial purposes. At one level, it's sad that people lack human connection so much that they turn to these mechanical alternatives for emotional support. It's like putting a Band-Aid on a deep wound. But AI does fill the need, partly and imperfectly. Many people find chatbots supportive and helpful. There are dangers. There have been reports of AI chatbots encouraging suicide in depressed teenagers and reinforcing delusional beliefs in people who are suffering from psychosis. But by and large, it's been a positive thing. People enjoy positive emotional support from AI. The problem is, they think it's therapy. Psychotherapy and emotional support are two very different things, but in recent years the distinction has gotten lost. Several factors account for this, and I'm sorry to say a large part of it is from therapists themselves, ourselves. In the mid-20th century, as a kind of rebellion against psychoanalysis, some therapists developed what they termed humanistic or client-centered therapy. The idea was to downplay or reject psychoanalytic technique and just let the warmth of a positive human relationship, the therapy relationship, do the healing. Now, they were onto something. Over the years, this has been widely accepted, and other schools of psychotherapy, including psychoanalysis, have incorporated some of these humanistic approaches. But unfortunately, this idea that the relationship itself is healing also blurred the boundary between psychotherapy and emotional support. Is a warm, therapeutic relationship the same thing as emotional support? Well, no, actually it's not. It's important to realize that even these humanistic therapists saw what they did as treatment, as a professional service delivered with expertise, with professional standards, and with an aim to relieve the patient or client of their psychological problem, to heal something that wasn't working in their client's emotional life. The therapeutic relationship was the instrument of treatment. In contrast, emotional support isn't treatment. It's not a professional service that requires years of training, and it doesn't require a diagnosis or an assessment, understanding what the problem is. You can provide emotional support generically without any reference to specifically what the issue is. Also, psychotherapy has clinical and ethical standards. If we do it wrong or unethically, that's called malpractice. There is no such thing as malpractice when you're just providing emotional support. Meanwhile, other therapists, especially those who call themselves trauma-informed, quote-unquote, have more recently begun avoiding pathologizing their patients. That is, recognizing anything that's wrong in the patient, him or herself. They wrongly equate doing that with, quote, blaming the victim, unquote, which it's not. When doctors diagnose people with medical diseases or illnesses, they're not blaming the patient for having that problem. And likewise, it's not anyone's fault if they suffer depression or anxiety. It's not about blame. This idea of avoiding labeling and diagnosing and even avoiding the idea of treating a disorder is couched in political arguments that diagnosing people is a power imbalance, that it reflects a dominant discourse in society that can be oppressive, and so on. Some of these concerns are valid. We should be aware that money interests, for example, can steer patients towards one kind of treatment and away from another, or that racial and gender stereotypes can influence how we assess and treat clients or patients. But to throw out diagnosis and expertise and even the idea of treatment due to these concerns, it's just foolish. Patients themselves want to know what's wrong with them, and many take comfort in having a name for it. And they certainly want it to be relieved. They want treatment. Actually, back in the 1970s, the psychologist Marsha Linehan had a better handle on this issue than some of my colleagues do now. She developed dialectical behavior therapy, or DBT. And the reason it's called dialectical is that it accepts patients as they are and also recognizes the need for change. A dialectic is a kind of a paradox where there's a need to accept both sides of the argument at the same time, even though they sound like opposites. In another video, I explain how all good psychotherapy is dialectical in this way, promoting change and also self-acceptance. That video's right here. One without the other is only half the puzzle, although some of my colleagues seem to have lost sight of that. By rejecting pathology, expertise, and the dominant discourse power structure, therapy is reduced to validating and normalizing a client's feelings of victimization, promotes self-acceptance but not change. It's basically emotional support. So I've talked about humanistic therapists unwittingly blurring the boundary between psychotherapy and emotional support. They didn't do that on purpose, but it was later interpreted that way. And about other therapists who, for political reasons mostly, avoid all of the things that make psychotherapy special and different, such as identifying and treating an emotional problem. In addition, almost all therapists nowadays self-promote. Now, I'm pretty old, but back in the olden days, medical doctors, lawyers, and psychotherapists never advertised. It was all word of mouth and referrals from other professionals. Kind of gatekeeping, I guess you could call it. These days, we all have websites and online directory listings for our practices, and some of us are on social media. And now that we advertise in various ways, it's become clear that selling emotional support is a lot easier than selling the hard work of psychotherapy. In addition, we are competing with large companies now like BetterHelp, whose ads clearly emphasize emotional support much more than the hard work of psychotherapy because they know what sells. And some licensed therapists are now expanding their practices into coaching, like life coaching, which is not psychotherapy. It doesn't even require a license, but it's easier to sell. It's easier to get clients. Last but not least, influencers on social media reduce psychotherapy to therapy. And I've talked about this in a number of videos. It may sound like therapy is just a short form of the word psychotherapy, but it covers much more. It's a loose catch-all for coaching and advice and tips and tools and inspirational sayings and cognitive exercises and oversimplified terms like narcissism and psychopath and so on. Pop psychology, basically emotional support. So between therapists themselves offering something like emotional support, advertising their practices as mostly emotional support, including some of them coaching, which is a kind of emotional support, and then you add to that people who are not licensed therapists offering therapy adjacent things like coaching and advice and advocacy and tips and tools for living and so on. And then you add to that AI chatbots available as close as your phone 24/7, providing something that people think is therapy by mimicking human conversation and being supportive. It's not hard to understand why the public no longer recognizes the difference between emotional support and psychotherapy. So what is psychotherapy? Psychotherapy is a clinical service delivered by a trained and licensed mental health professional, such as a psychologist, a psychiatrist like me, clinical social worker, marital and family therapist, a licensed professional counselor, and others. It's based on a healing human relationship, as the humanist therapist said, but it also includes specific clinical techniques depending on the school of therapy. It's a treatment for psychological disorders, emotional problems. Now that rubs some people, especially some therapists, the wrong way. They'll say, my clients don't have any disorders. They simply suffer emotionally, and suffering is not a disorder. Well, that's a nice sentiment, but it flies in the face of reality. Emotional suffering comes in different kinds. A person can be suffering because they're being tortured or abused by somebody else. They can be suffering because they torture themselves. Or they can be suffering for medical reasons, like a tumor is pressing on a nerve. We're not doing our patients or clients any favors by pretending there's no difference between those things. Psychotherapy can't treat torture or abuse or oppression by other people. And it can't treat tumors pressing on nerves. But it can and should treat self-torture. By definition, psychotherapy treats something that's wrong in the patient or client. Many patients recognize this themselves, that there's something amiss in the way they feel or think or are behaving in relation with other people. It's not their fault, of course. The service we offer is to help clarify what that problem is, and to propose a treatment plan to relieve their suffering. A general chatbot can't do any of that. It can't comprehensively assess you for your emotional problems. It doesn't have a theory of treatment that it can put into a treatment plan, and it can't assess your progress along the way. By the same token, it's a waste of money to go to an expensive mental health professional like me or a psychologist just to get emotional support. You can get emotional support much more easily and at far less cost. And actually, it's not our job to do that. We're supportive at times, but really only as a component of treatment. It's like the difference between being a friendly therapist. I try to be friendly with my patients, but I'm not their friend. It's also something like the difference between a health club and a cardiologist. A health club or a gym is much more pleasant, easier to access, and less expensive than a heart doctor. It's easier to advertise a health club, more people like it, and it can even help more people feel better in a general kind of way than a heart doctor can. There's no diagnosing or treating. But nobody thinks that a health club or a gym can substitute for a cardiologist. If you have a serious pain in your chest, don't go to a gym for help. When much of the public praises AI therapy, which doesn't even exist in these general purpose chatbots, it's clear that there's confusion about what psychotherapy really is. This isn't new. For generations, people have said that their bartender or their hairdresser is a really good therapist. They really know how to listen, even though those people aren't psychotherapists either. Judged by the standard of emotional support, bartenders and AI chatbots will often do a better job than a psychotherapist. We psychotherapists can't compete with AI chatbots any more than we can compete with family, friends, or bartenders. Any more than cardiologists can compete with health clubs. Not because they perform our work better than we do, but because they don't perform it at all. We need to make the case that we provide something more and different, frankly more valuable, than mere emotional support. Thanks for watching. This channel, More Than Meds, is about psychotherapy and psychologically informed psychiatry. It's not primarily about AI therapy, but I have done a few videos on that. And this is the playlist. Please like this video, but only if you like it, and please subscribe. I welcome your comments below, and see you next time.